Welcome to UCLA's Jules Stein Eye Institute. Here you'll receive care from some of the best doctors and surgeons in the world. You'll have access to the latest state-of-the-art medical equipment and benefit from the cutting-edge research that our university is involved in every day.
You'll also receive the best quality care from our highly trained team of nurses and staff who are committed to make you feel comfortable as possible.
The video you're about to see gives you some important information that you'll need to know before coming here for your surgery. You can also read and print this information on our website, www.jsei.org.
Thank you. We look forward to taking care of you.
Preparations for your visit begin before you come to the Jules Stein Eye Institute. On the day before your procedure, you will receive a call from the Jules Stein Eye Institute pre-treatment nurse between the hours of 2 and 4 p.m. The registered nurse will tell you the time you are to report for your procedure and answer any question you may have. If you do not hear from the JSEI by 4 p.m., then you should call 310-825-5031. Please make arrangements to come with someone who can stay through the procedure and drive you home.
Could you please ask Ms. Wong when was the last time she had something to eat or drink?
If you have limited English proficiency, we offer interpreter services at no cost to you. Just notify the pre-treatment unit staff the day before your surgery. If you develop a cold, fever, or rash, please call your surgeon. Your surgery may need to be postponed. Do not eat anything after midnight the night before your surgery, including gum or candy. Adults may have small sips of only water, Pedialyte, or Gatorade, but only up until 3 hours prior to arrival for your surgery. Remember, take nothing in your mouth within 3 hours of your arrival at UCLA, unless instructed otherwise. Do bring a BiPAP or CPAP device if you use one.
Good morning.
Good morning.
How can I help you today?
Hi, my 3-year-old is having surgery today.
We recommend that 2 adults accompany a young child preparing for surgery at Jules Stein. Please follow these guidelines. Infants younger than 6 months old may have breast milk or formula until 4 hours prior to the time you arrive at Jules Stein Eye Institute, and water or Pedialyte until 3 hours prior to your arrival. Children between 6 months and 3 years old may have solids until 8 hours prior to arrival, breast milk or formula until 6 hours prior to arrival, and water, Pedialyte, or Gatorade until 3 hours prior to arrival. Children older than 3 years may have solids until 8 hours prior to arrival, and water, Pedialyte, or Gatorade until 3 hours prior to arrival. The Jules Stein Eye Institute is located at 100 Stein Plaza in Los Angeles at the entrance to the UCLA campus. From Wilshire Boulevard, go north on Westwood Boulevard. After you pass LeConte Avenue, you'll see the UCLA Medical Plaza on your left-hand side. Jules Stein is directly across the street on the right side. The parking kiosk is immediately to your right as you drive in. Both Jules Stein and the parking kiosk are not open until 6 a.m. Please do not bring any valuables as everything you need will be provided for you. From the parking lot, go up the elevators or stairs to the plaza level. Exit the elevator and turn right. The Jules Stein entrance is the double doors directly in front of you. Proceed to the elevators in the rotunda and go up to the A level. Turn right out of the elevators and the patient check-in room is A231.
Mr. Wilson, what's the best number we can reach you at?
On the day of your surgery, please provide the name and phone number of the person who came with you. A nurse or doctor will update them in the waiting room or on their cell phones as soon as the procedure is finished. Please keep in mind that most procedures at Jules Stein are brief, usually no more than an hour. It's important for them to be able to speak to the physician immediately after surgery.
Thank you. I'll be right up.
You'll have the opportunity to see your anesthesiologist.
Good morning, Mrs. Wilson. I'm Dr. Keys from anesthesia.
And have all other questions answered on the morning of your surgery. Following your surgery, you will recover in the post-anesthesia care unit, also known as PACU. One visitor is allowed in this area after the patient wakes up from their sedation or anesthesia. A doctor or nurse will answer your questions before you leave Jules Stein. Remember, make sure someone accompanies you to Jules Stein Eye Institute and helps you get safely home.
Hi, good morning. This is Terry from Jules Stein.
You will get a follow-up call from a registered nurse the following business day. Our team of doctors, nurses, and staff is here to provide you the best care possible before, during, and after your visit to the Jules Stein Eye Institute.
Following the instructions on this video is very important to making sure you have the best outcome from your surgery.
So thank you for watching, and thank you for choosing Jules Stein Eye Institute.